Polio is a disease caused by the poliovirus. The disease is highly contagious and spreads through contaminated water or food, direct contact with someone infected, and poor sanitation and hygiene. Some inhabitants of Rundu in the Ndama Location settled near the sewage pond. Inhabitants also walk through the sewage yard on a daily basis as a shortcut. This is a risk factor, they shared. The ministry aims for zero polio infection.
Us as a ministry are doing everything that we can to ensure that there is no transmission, that there's no death, and there's no outbreak. Currently, there's only an event. And we want to make it very clear that we have no case currently, human case. But we want to prevent that from happening by ensuring that we have our children immunized against this polio type 2.
The polio disease was detected through the ministry's routine environmental surveillance on 13 November 2025. The vaccination is a preventative measure to ensure that there is no outbreak. The Zero Polio vaccination campaign in the two Kavango regions will commence on 15 December up to 18 December 2025.
Anybody child born from April 2016 to date has no immunity against type 2. So the chances of the person coming down with paralysis is high, or maybe dying from the infection when there is where the respiratory systems are affected. So that is why we took the target of under 9. If you look at 2016 to end of December, it's almost under. That's why we took under 10 people that are 0 to 10 years, so that we make sure we build the immunity of those children that are in that age group. So you also look at, if you look at Namibia, we introduced the other aspect area you can get type 2 immunity is through IPV. But the IPV gives immunity for the ones that happen around the blood system, not the ones around the gut. And the IPV2 we introduced, it was 2023.
The virus detected is also known as circulating vaccine-derived poliovirus. Upon detection, a team of public health experts was deployed to conduct rapid risk assessments in communities, search for possible human cases, and strengthen cross-border surveillance. Namibia has been polio-free for many years. The last outbreak was in 2006. Governor of Kavango East region, Nguundja Uambaruru, urged for calm.
I call on the media, parents, guardians, caregivers, community leaders, and all Namibian people to be aware of the disease and prevention measures like mass vaccination of children less than 10 years of age. Ensure proper sanitation in communities, disseminate accurate information, and guards against rumors and misinformation.